Hello friends, welcome back to my channel. In this video, we are going to see about muscles of arm. So muscles of arm, it consists of 4 muscles. Front of arm, 3 muscles are there, and back of arm, only 1 muscle is there. So front of arm, 3 muscles which are biceps brachii, coracobrachialis and brachialis. Back of arm, there is only 1 muscle that is called triceps. So now we are going to see about origin, insertion, nerve supply, action, and some of the peculiarities of these muscles. So these things we are going to see in this video. So this front of arm and back of arm, it is formed by the intermuscular septum. So this arm is having an intermuscular septum, that is medial, and lateral intermuscular septum is there, which divides the arm into anterior aspect and posterior aspect. Let's move on to the video. Now this is your front of arm. So front of arm is having 3 muscles. This is biceps brachii, coracobrachialis and brachialis. First one, we'll see about biceps brachii. This biceps brachii has 2 heads, short head, long head. Short head arises from coracoid process of scapula. Long head arises from supraclinoid tubercle of scapula. Insertion, biceps tendon inserted into radial tuberosity. Medially, the tendon becomes a sheet-like, which is called bicipital aponeurosis. This aponeurosis attached into the posterior border of the subcutaneous part of the ulna. So biceps tendon inserted into radial tuberosity, and bicipital aponeurosis, it goes along the medial aspect and get into attached to the posterior border of the ulna, that is the most subcutaneous part of the ulna, which is called bicipital aponeurosis. Nerve supply, musculocutaneous nerve. Action, it is the powerful supinator of forearm and fluxes the elbow joint. The next one is coracobrachialis. This is the next muscle, coracobrachialis. It is originate from the coracoid process of scapula. It is just along with that related with the biceps. So this arises from coracoid process of the scapula, and it is inserted into middle of the shaft of humerus. It is inserted into middle of shaft of humerus. In this muscle, it is supplied by musculocutaneous nerve. Musculocutaneous nerve is the one which is arising from the lateral cord of brachial plexus. It has a peculiarity that the musculocutaneous nerve pierces the coracobrachialis muscle and then it is supplying. So this is the thing which is important in a coracobrachialis. And action is, it is the weak flexor of shoulder joint. And this muscle has a peculiarity, that is coracobrachialis. Sometimes there's a fibrous band like which is attached in a supratrochlear spur that may extend from the lower end of the humerus to medial epicondyle. And that extension, we can call it as ligament of Struther. So ligament of Struther, it is just the remnant of coracobrachialis. This is one of the important peculiarity when you are going to read about coracobrachialis muscle. Then the third one is brachialis. So brachialis is the one which arises from anterolateral and anteromedial surface of the humerus, and the tendon is inserted into ulnar tuberosity. This tendon is inserted into ulnar tuberosity. Nerve supply, this muscle, it is having dual nerve supply. It is supplied by musculocutaneous nerve as well as radial nerve. Action, it fluxes the elbow joint. So this is about brachialis. Brachialis has a peculiarity that is it has a dual nerve supply. So biceps brachii muscle, it has a peculiarity that is bicipital aponeurosis is there, which is attached into the subcutaneous part of the ulna. And Coracobrachialis, it is having a peculiarity that is the ligament of Strutter. And the Brachialis is the one which is having a dual nerve supply, that is musculocutaneous nerve and radial nerve supplies the Brachialis. And in the back of arm, there is only one muscle that is called triceps. Triceps, it is having three heads. It has long head, lateral head, and medial head. As because it is having three heads of origination, it is named as triceps. The long head arises from infraglenoid tubercle of scapula. Here you should remember from the supraglenoid tubercle, biceps arising. From the infraglenoid tubercle, a long head of triceps head originates. And now the lateral head originates the lateral lip of spiral groove, that is above the spiral groove. And medial head originates around the posterior surface of the humerus, that is below the spiral groove. Medial head originates below the spiral groove and it covers the whole posterior surface of the humerus. These three heads of the muscle get inserted into olecranon process of ulna. This is the olecranon process of ulna. It is inserted into olecranon process of ulna. It is supplied by radial nerve and the action is it produces extension of elbow joint. So these are the things we have seen about triceps muscle. So I think this video is helpful to understand front of arm and back of arm muscle. Thank you for watching this video. If you like this video, please share and subscribe. Don't forget to click the bell icon. Thank you.